I'm going to go ahead and hit record. Again, thank you to everybody that is able to join. Please reach out to me if you have any interest in joining nutrition section, or if I can help connect you to any other sections. If you have any speakers that are nutrition related, or you yourself, reach out. We'd love to have you. Anything related to the association that I can help with, let me know. Dorothea has our next lunch and learn that we are doing in the new year. She's going to kick us off, get us going on the right path on our health and wellness journey. Dorothea is with Blue Cross Blue Shield. She's a wellness coordinator. So we have that set up for Wednesday, January 15th from 12 to 1. There will be a flyer coming out soon, and y'all can register for that one as well. So I will turn it over to Abby here in a second. This little darling happens to work for me. She is my registered dietitian that I have on staff with me. She's fantastic. She has experience in a lot of different things, part of why I hired her as well. So she has a background in clinical nutrition, working in the hospital system at St. Francis. She also has done private practice work with Brittany Jones, her company out of Greenville. So she has a variety of experience. And I thought, this would be a really great talk. I feel like a lot of people have interest in this, especially around the holidays. She gets to do a lot of cool work with Clemson Rural Health. Y'all see she just had some patients. She's running my initiative down in Abbeville. So I'll let her add anything else she would like to about herself, her program, any of the work that she's doing. And then she's going to take it away and tell us all about the holidays.
Yes. Hi, you guys. I'm happy to be here. I'm going to share my screen real quick for a little presentation. Let's see here. 1 second. Present. Present here. All right. Can everyone see that? Is that good? All right. Perfect. All right. So I am going to have to jump off a few minutes before 1 because I am on jury duty this afternoon. Yay. And on Thursday. But we'll go through this. But of course, if you have any questions along the way, I'm happy to chat about those. And then our lovely intern, Diana, that we have with us right now, is also made a handout based on this information. And Brooke can also send that out as well after this. So yeah, today's topic is healthy holiday habits, healthy eating around the holidays, everything like that. I wanted to share first, Brooke covered this a little bit about me. So I have been a dietitian for coming up on almost 4 years now, actually. I graduated from Clemson in 2020, the year of COVID, and the world turned upside down. And then I was accepted into my dietetic internship through Morrison Healthcare. It's a distance internship, meaning they're based out of Atlanta, but they take interns and place them all across the country. And I'm matched to do that at St. Francis in Greenville, South Carolina. Because in all honesty, the internship does not pay, and I wanted to live at home. And so my parents are from Greenville, and that's what I did. And then after I completed my internship in March of 2021, I passed the exam to become a dietitian that April. And then I got hired as an inpatient dietitian at St. Francis about a month or two after that in 2021. I was there at St. Francis from 2021 until 2023 as an inpatient dietitian. I was focused on critical care, so ICU, CCU. I also covered the surgical floor and our neurology and orthopedic floor as well. So I kind of bounced around to a couple different floors, but I love critical care. I love the complexity of the patients, new experiences every day. It was also, I started during like the second big surge of COVID. So it was kind of baptism by fire. I learned a lot on my feet in a short amount of time. I was seeing the max number of patients we could see, right off the get-go, no real orientation. But I absolutely loved it. I had an incredible group of dietitians working with me. They were a lot more experienced than I was, which I was very, very glad for because they were able to mentor me, teach me, and give me some really great foundations on being a dietitian. I wasn't really looking for a new job, kind of just passively. And then it popped up this job at Clemson. I got the job posting notification, and in my head, I live in Clemson. And I was like, this seems too good to be true. I don't know what all this is about, So I applied for it on a whim, and then kind of the rest is history. Once I heard about the job, I was like, oh, this sounds awesome. And of course, working for Brooke is also awesome. So I started in February of 2023 with Clemson Rural Health underneath Brooke. I was the second dietitian she hired to work at Clemson Rural Health. And I am the lead dietitian and now project manager for our Fresh for Life program in Abbeville. Y'all may have heard Brooke talk about it before, but it is a clinical study down in Abbeville, focusing on nutrition interventions for people with type 2 diabetes. We provide them with prescription produce, one-on-one MNT, medical nutrition therapy counseling, as well as cooking demos. And then we're taking their A1C before and after, as well as cholesterol, weight, blood pressure, to see if we can make some changes. We're coming up to the kind of the end of this project in 2025. It'll wrap up, and we've seen some wonderful changes that just kind of validate why I made the switch from inpatient to more of a kind of a hybrid community, business, college, all the things is what we get to do. So it's a great time. And like Brooke said, I also have experience in private practice, specifically in any GI related nutrition, and also women's health. So like PCOS, perimenopause, postmenopausal, all of that, those forms of nutrition there as well. So if you have any questions about that too, I'd be happy to chat about those as well. And then that's my dog, Henry. He just turned 2, so I figured I'd put him up here as well. All right, so enough about me while you guys are all here is to talk about healthy holiday habits and kind of how we can stay motivated during the holiday season. And kind of first and foremost, what I always like to say is dietitians, and Brooke says this as well, is we believe all foods can fit. So you're never going to hear, if it's a good dietitian, you're never going to hear us say that you need to get rid of this food or you can't have this food or stop eating that. We believe in moderation. You can enjoy every holiday, every life event, but also still have time to kind of meet your goals and stay on track with your health and wellness. And there are a few things we can look at to do that. So like I said, holidays are a time for celebration, but sometimes, they can disrupt the habits and the patterns that we're in. And a lot of times I hear too, especially this is what I've been focusing on my patients, especially today, is they feel like they're in such a great routine with things. We're getting started in new school year, September, October, motivation's a little bit higher. Then it rolls around into Thanksgiving, and then kind of Thanksgiving kind of slides right into Christmas. And then before you know it, it's the new year. And then we hear kind of that typical, okay, well, I'm going to start again in the new year. Well, what about those 2 or 3 weeks in between Christmas and the new year? We could still be doing something then that would make a difference. So it's really that all or nothing thinking is what we encounter a lot of times. So it's either I have to be perfect on Christmas or I have to be perfect on Thanksgiving. If not, it's all a wash, kind of all or nothing. So those are the things we see most often, but that's not true. So in that same vein, those common challenges is going to kind of be that overindulgence, that all or nothing that I just said. Maybe, we're enjoying all the holiday desserts, the work parties, if you go out to eat, things like that. That's how we celebrate here, especially in our culture. We celebrate with food and social events and coming together, drinking, all the things if you participate in that. But like I'll talk about, there are ways that we can kind of, pick and choose what we do or ways around that. Another huge one is some irregular eating patterns. So skipping meals, eating meals at different times. I heard this a lot in Thanksgiving. I'll hear it a lot at Christmas, even from my own family members. Oh, I didn't eat it all today to save up for this meal. Or after Thanksgiving, I had a huge Thanksgiving meal. So on Friday, Black Friday, I'm not going to eat anything to make up for that. And that's where I'm like, no, that actually does more harm than good. And we'll get more into that too. But that's another typical, challenge I see around the holiday season. And then finally, some limited healthy options, either at your holiday events that you attend. If you're getting something catered or you're going to a work event or something like that, there can be few and far between healthier options, or even celebrating with families and things like that. So all of those things can interfere with our normal eating patterns, making it hard to get back on track. But we can work through all of those things. So some strategies to combat this is, first, I want to break this up into if you are hosting like a holiday event with your family or a get together with friends or something like that. It's focusing on what you can control in your own setting. So maybe, a common thing I like to do is I had a big Friendsgiving event. We had all of our friends to our house. There was about 30 or so of us. And I asked everyone to bring an appetizer or a dessert, and then we provided the actual main entree and then the salad and some sides of vegetables and things like that. Just so I knew, okay, there's going to be a mix of everything here. There's going to be, I know I'm going to follow, get some protein in at my meal because that's what we had on our entree. I know I'm going to get some nice veggies in with this salad and another side dish I made. And I also know I'm going to enjoy my favorite foods with all the other things that my family and friends are going to bring to the meal. So making sure if you are hosting the event, you can supply some of the healthier food items and have everyone else bring in some dishes to kind of supplement that. Um, and then the next thing, and we always talk about the plate method, is you can do this wherever you go, but really you can probably follow it most easily if you are hosting something on your own where you're more familiar with the foods you're going to have. So the plate method, it works if you're diabetic, it works if you're not diabetic. It works if you're on a diet, it works if you're not on a diet. It's really just the best way that we can follow the most healthy diet without calorie counting, without worrying about any macronutrients or anything like that. So it starts with filling up half of our plate with our non-starchy vegetables. On this diagram, it says fruits and vegetables, but ideally our non-starchy vegetables take up half of the plate. And so those are going to be the things that are not our corns, beans, peas, and potatoes. Okay. So all the good vegetables that you get in the casseroles and things like that, and the dips, those are going to be our starchy vegetables. So we can certainly still have those, but we have to remember that those vegetables would go in this carbohydrate section of the plate. So any other vegetable except for those four, fill up half of the plate. Now this is a little different if we're doing like a fried vegetable, or again, like I said, that casserole dish. So those things that have some added fats in them, or some carbohydrates, some breading, some stuffing, things like that. We'll have to be mindful of those. But any grilled vegetables or a soup or a salad or something like that, that can take up half of your plate, no problem. Once we do that, that allows us to feel more full because it's packed with fiber in them, vitamins, minerals, and then cuts down on us maybe overindulging or going back for thirds, fourths on some of those other foods. Speaking of that, something I also like to talk about is it's perfectly fine if you're still hungry and you want to enjoy some other of those foods. If we're going back for seconds, try again filling up half of your second plate with the non-starchy vegetables, starting with those first, and then see how you feel after that. Usually 9 times out of 10, we're going to feel nice and full from that second helping of vegetables, that reaching for some more of the desserts or some of those other carbohydrate rich options is not going to be as top of mind. And I say, if it is, then have that serving size after that and see how you feel. We're not depriving ourselves, but we're also making sure we get in enough of those essential things that we need on the plate. So starting with the vegetables, and then we're going to move into our protein options. So just like vegetables, having protein on our plate for every meal and every snack is key. It helps us balance our blood sugar, which is important for all of us, whether or not, we have diabetes or not. We all have our up and down blood sugar. You ever been hangry before? That means our blood sugar is probably low. Happens to the best of us. So pairing our protein on our plate, it's going to allow for our blood sugar to stay nice and stable, allowing you to feel better. It's going to cut down on some cravings, also cutting down on that crash after, you leave the Thanksgiving table and you got to go take a nap, feel like you're so tired you can't keep your eyes open. Adding some protein and some veggies is going to help with that. So that can be, the turkey, the chicken, any pork tenderloin. That's a common one at Christmas. Those are all wonderful options for protein. Even a little bit of cheese on there, something is going to be a good protein option. And then finally, focusing on our portion size of our carbohydrates is really going to be the biggest one. Again, like I said, you can still have these foods. So these are going to be all the good, typical holiday party, holiday meal type foods. The mashed potatoes, the stuffing, casseroles, any sort of dip, side items. That's going to fall right here. You can still have them, but 25% of your plate is going to be the golden rule of making sure you're following the correct portion size. And then again, whether or not you're hosting your own holiday party or you're attending, a different party, making sure that you're properly hydrated is going to be a great way to kind of stay on track too. Making sure you're drinking enough water. And then I like to tell people this too. If we don't want to give up, all of our favorite foods, that's totally fine. Can we replace a sugary beverage with a glass of water or an unsweetened drink? So maybe, we're going out to eat and instead of sweet tea, we get an unsweet tea or even replace that with water. If there's like a holiday drink and a punch bowl or something like that, maybe we have one glass of that and we drink water the rest of the time. There's kind of substitutions that we can make too that will help us stay nice and balanced and leave you probably feeling better, the next day than if we were continuing to drink those sugary beverages all night. So then we get into if we're attending like a work event or friends, potluck or something like that, we can offer to bring the healthy items to the gathering. So that way we know, okay, we know we have a healthy dish. If there's nothing else there, at least we know this is coming. I know Brooke and I a lot of times will bring, typical dietitians will bring a dip with some cut up veggies on there. We'll bring like some guacamole and some chips and some veggies and things like that. Something that's still fun and that people can enjoy, but it's a good, easy way to kind of front load your vegetables or even a fruit tray or something like that to get that on there as well. And then I always, again, what I've been harping on this whole time, balance your indulgence with like the mindful choices, picking on your plate. Okay, I'm going to have this here. Maybe I'm not going to go back for seconds on dessert. And really checking into being mindful about slowing down, when you are eating. It's easy to get caught up in talking to everyone and catching up and celebrating the holidays that it's easy to eat mindlessly and going back for those seconds and those thirds and not taking a chance to say, check in with yourself. Oh, okay, I am full. I'm just going to sit for a second and see, do I really need that plate? And just doing that mental check-in can go a long ways. I know for me, whenever I'm at a dinner with my girlfriends or a group of friends, I'm just talking. As Brooke and I say, we get paid to talk for a living, so we can talk. And usually, that's when I can just keep eating and eating because I'm not thinking about it. And then I stand up from the dinner and I'm like, oh my gosh, I am so full. What I've been doing this whole time, talking. So being mindful, checking in with yourself is also a good tip for any holiday function. And then always be kind to yourself, enjoying treats in moderation without any guilt. You don't need to feel guilt, especially if you're working on balancing that plate. Everything is fine in moderation. I just talked a while. Does anyone have questions on that so far? And if you don't, I'll just keep on going.
Yeah, feel free to come off mute, or if anybody wants to plug anything into the chat, I can read it for Abby if you have any questions so far.
All right. Well, y'all chime in at any point if you do. So then this goes back. So talking about smart snacking, and I don't believe I have this one on here too, but I'm going to circle back to the importance of not skipping meals and smart snacking. So like I said, a common challenge we hear is we're not going to eat breakfast because we're going to have a huge holiday lunch at about, 2, 3 o'clock with our family. Or we had a big holiday party, dinner the night before. I'm not going to eat the rest of the day. Or maybe if I am going to eat, it's not going to be until way later. Well, what happens in our body is that's really going to, mess up a lot of things. What it sends to our body, those signals, is it's going to say, your body's going to say, okay, well, I'm really full from, this meal. But it might start to get hungry later. It might not. And then you have that next meal and your body's like, whoa, I'm kind of off of my usual pattern. We just skipped a couple meals and now I'm eating another big meal again. And then let's just say you skip following meals after that and go back into another big meal. That kind of can create a not so good pattern where your body says, okay, I'm kind of out of my routine. I know that I'm not eating or I'm not eating like normal and I'm skipping meals. So I'm going to go ahead and hold on to everything that I just ate at this Christmas dinner. And I'm not going to burn anything off because I don't know the next time I'm going to have a meal. And then that cycle is going to continue. It's going to say, okay, well, I just had this big Christmas meal or this post-Christmas meal. I'm having a lot of leftovers, but I don't know the next meal I'm going to have. I'm going to hold on to this too. I'm not going to burn it off. What that is that's your metabolism. So as we get into those patterns of skipping meals, your body gets into almost a fight or flight mode and it holds on to all those foods that we have and it doesn't allow us to burn them off, make our metabolism go down. I like to say, even if we have a really big meal and you're not feeling super hungry, but it's been a couple hours since you've eaten, or even the next day, try to have something with a little bit of protein in it, a little bit of a snack. It could even be as simple as a spoonful of peanut butter. But what that does is it helps regulate our metabolism and it allows our body to come back into that state of homeostasis, or that state of balance, and say, okay, I know that I just had, my snack of peanut butter, spoonful of peanut butter. And I know in a couple hours, I'm going to have another balanced snack. I'm going to go ahead and burn this off. And we get back into that routine. Our metabolism starts to go back up. It also helps with blood sugar regulation. No matter where we are at in our health journey, whatever diagnoses that we have, blood sugar regulation is important to everyone. Eating every 3 to 4 hours, regardless of what meal you had 4 hours ago, is key. It's going to help our blood sugar stay nice and stable instead of going up and down and up and down. It just helps us feel better. It prevents that kind of crash or that burnout after eating the meals. It can prevent some nausea. It's better for our GI system regulation there. It's better for our mental health and our mind. So really making sure that we're eating every 3 to 4 hours, no matter the size of the meal that we had, is going to be important. And then that also comes into smart snacking. So choosing some nutrient dense snacks that pair a protein, protein by itself, or even pair that protein and that carb together, is going to be important. So not just reaching for an apple to have, but making sure we have an apple and a protein. So an apple and peanut butter, apple and cheese, maybe it's a Greek yogurt, something like that. It's really going to be beneficial for us in the long run and just help you feel better after the holidays. So that way you're not getting to January 1st or just December 31st and saying, oh my gosh, what have I been doing, this whole time? I got to get back on the wagon. That way we're already on the wagon. We don't even have to think about it. We just continue those patterns. All right. And so then my next one, so I forgot to touch on this too, but another one of my passion jobs is I am a group exercise instructor. I have been for 8 or 9 years now. It's one of my favorite things that I do. So I always preach the importance of staying active, but staying active through joyful movement, something that makes your body feel good, and that you can do without dreading. Because exercise, I say this in every presentation, exercise should never be a punishment for what we ate, but it should always be a celebration of what we're able to do. So whether it's just taking a family walk after a meal, or doing some holiday games with kids or grandkids, like a hide and go seek, pin the tail on the donkey, something where you're up and you're moving, that counts as physical activity. It could even be doing a quick workout at home, like cleaning your house, getting up and doing that. All of those things count as physical activity. And that the consistency of this, especially during the holidays, matters more than the intensity of it. So I don't expect you to go out and run 3 miles to try to burn off your whole Christmas dinner or a holiday event, but just being consistent and taking those walks a couple times a week, or being active with friends and family, it's going to make much more of an impact in the long run. Because that way, if you enjoy it, you're going to want to do it and continue to do that. And also walking after the meals, or finding some sort of physical activity after the meals, just aids in our digestion. It helps us digest the foods better. It can prevent that fatigue and that want to kind of sit on the couch and stay. And it just helps you feel better in the long run. Okay. I just saw a question in the chat from Samantha. What do you think are good ways to make healthy snacking more part of our routine consistently? Wonderful question. So for me, I'll just give an example. Last week, or the past 2 weeks, have been super crazy, and I did not prep my snacks ahead of time. And boy, did I feel it. I was more hungry during the day, or I was like, eating foods out of my pantry, kind of scavenging in them, trying to find the snacks, or I just like was not eating and was miserable. So yesterday I made sure to go to the store and get some good balanced snacks that I could prep and that could sit in my pantry, sit in my fridge. And that way, when I was leaving for work out the door, I know I have my snacks ready to go. So meal prepping, just the snacks, is going to be a huge thing. To make sure, I'm skipping everything because I'm clicking, to make sure that we stay on track with that. So for me, I actually have 2 of my favorite snacks. I'll show you right here with me. So for right here, I love these chomps. Diana, our intern, also eats these a lot of the time. They're like, basically, I like to call them a healthier Slim Jim, because they don't have any like processed added sugar or anything in them, but it's just 10 grams of protein and they taste super good. You can even get the mini packs. If you have like a Costco or a Sam's Club near you, you can buy these and they're a lot better value. So I'll throw these in my purse. I'll make sure I get 5 of these during the week. I'll throw them in my bag each day. In between patients, I'll snack on one of these. In my car, I'll eat one of these. Another one of my favorites that I've been seeing are these Chobani Completes. They're like, if you guys have ever had like Danimals drinkable yogurt, or like the Trix yogurt, it's like the cotton candy flavor that tastes good, but maybe not so good for you. These taste very similar to that, but they're 20 grams of protein in them and they don't have any added sugar. So I love picking these up, throwing in my bag. I can sip on it throughout the day in the car. So really good options there to kind of pair. But yeah, my biggest tip is just to kind of think about it over the weekend or at the beginning of the week and just have those kind of accessible snacks that you don't have to think about a lot, but are there. Throw them in your bag. And that's my best trick to stay consistent with it and to ultimately, feel better in the long run doing that. And Diana said, I just had a chomp 30 minutes ago. Yes, that's about right. Okay, Samantha. So it looks like I answered your question, but wonderful question. And then Dorothea said, what are some tips for eating healthy during menopause? That's a wonderful question. So during menopause, obviously we know, as women, we're going to have a huge hormonal shift. Our hormones are going to be up and down, going every which way. A lot of times too, we might have some appetite changes and even some taste changes are common too. Our taste buds may change. Things that used to taste good don't taste good anymore. So it's a hard time figuring those things out. And that's where we may see some fluctuations in our weight retention or muscle mass, things like that. So the biggest tip I have nutrition wise is to really, really focus on following that plate method, really being diligent about eating half of your plate with those non-starchy vegetables, really watching our portion size as best we can on our starchy foods, 25% of the plate, and then prioritizing protein as much as we can. Because in menopause, with a shift in our hormones, we're also not absorbing, in most cases, the amount of calcium and vitamin D that we should, which can lead into that osteoporosis or osteopenia, where our bones start to break down and we're not retaining as much muscle mass. So eating those proteins for every single meal and every single snack and increasing our vegetables, it's going to be the two best things that we can do in terms of making sure we get our necessary macro and micronutrients, as well as if weight maintenance or weight loss is your goal through menopause. That's why I say the plate is the best friend through all stages of life. It's really going to be the best thing to follow. And then just being mindful too is if we're not being active, as much as we once were, making sure our meals kind of reflect that. So sometimes portion sizes may need to be adjusted depending on activity level and things like that. So just being mindful about that as well. But those are wonderful questions, you guys. I hope I answered them. Okay, next slide. So a big thing around the holidays, I think for anyone, I'll speak from experience. Me and my family, we were just together this weekend, and stress and mental health is, a big thing that we all need to focus on. It just comes with the season, right? So stress management is going to be key because stress plays a big factor in our appetite. You can either be a stress eater or someone who has no appetite when they're stressed. And both of those things we have to be mindful of and try to set us up for success in managing our stress. So whether it's practicing our deep breathing exercises, or this one is a big one, setting realistic expectations to avoid the holiday stress. I think at least for my husband, he goes into a lot of things with rose-colored glasses on. Even after every single holiday, something happens, stressful. And so it's just talking about those things and saying like, okay, we're kind of expecting this and that to happen. And, since we're expecting it, it's okay if it happens. We'll just let it roll off our back and, we're just going to continue as it is. So just having realistic expectations for yourself around the holidays is a really healthy thing to do. And then again, prioritizing your self-care, whatever that looks like for you, but taking time to do something that you enjoy, it's going to be the most beneficial thing. So whether that is participating in exercise, Maybe it's taking time to go read a book for 30 minutes. Maybe it's any other holiday that you have, calling a friend on the phone, going out to dinner with a friend, something like that. But really finding something that you enjoy and making sure you are adding that to your busy holiday schedule. That way you don't experience any burnout. Or, we're heading into Christmas break. I know Brooke and I are probably like, oh, we cannot wait to get to this break. That probably means we need to prioritize more self-care. So we don't have that burnout and things like that. So that's always important to, try to watch. And then if you do partake in any alcohol consumption, just making sure that's in moderation if we can, or even limiting that, if we know this doesn't make us feel our best, or, family things, alcohol can be tricky. So just going into that and finding that expectation for yourself is important as well. And then another big part of sleep or part of stress and mental health is going to be our sleep. So maintaining a consistent sleep schedule even during the holidays. So I know sometimes when we're off of work, our sleep schedule can get a little lax, maybe staying up later, especially with family and friends, sleeping in later. And then that can kind of go and go and go until we're staying up until the wee hours of the night and sleeping in really late. And then when we get back to work that following week, it might hit us like a ton of bricks. So trying as best we can to be mindful of keeping relatively the same sleep hours. Now, should you wake up at 5 a.m. when you don't have to? Absolutely not. But prioritizing about 7, 8 hours of sleep when we can is just going to help us feel our best. That can be through our bedtime routine, limiting phone, maybe reading a book before bed, avoiding caffeine before bed, avoiding a big heavy meal before bed, making sure we have proper time to digest our foods is going to be important. And then finally,
Abby,
we
you
have,
got a good question in the chat.
oh,
It ties in with what you're talking about with caffeine.
uh-huh.
She said, what do you think are good ways to try to reduce caffeine consumption if you do consume a good bit of it?
Yeah, so that's a great question. I think it kind of goes back to the root too of why do we need to consume so much caffeine? And taking a look like it's sleep habits, mental health habits, self-care habits, and say, okay, why am I feeling so tired? Is it a habit that I'm consuming this much caffeine? Do I truly need this much caffeine and why? But in terms of actually like reducing our caffeine intake, just kind of trying to limit where you can. So if you are doing, 3 cups of coffee a day, a lot of times I found it's kind of, the taste of coffee that you're used to. So can I switch to 2 cups and have my third cup be decaf, and see how I feel? I know now for me, I do have to have my 1 to 2 cups a day or I will get a headache. And, I'm working on that. But do I still feel good if I do my 2 cups of caffeinated and 1 cup of decaf? Okay, I feel good. Maybe in 2 weeks, can I try to do 1 cup caffeinated? Can I do another cup decaf? See how I feel about that. So that's another way to kind of watch that too. And so also a lot of times when people are doing a lot of caffeine, they may not be doing enough water or hydration. And Samantha, I don't know if that's the case for you with hydration wise. But another rule of thumb I like to do for every cup of coffee I have, also doing a cup of water on top of that. And usually too, increasing our water intake can help alleviate some of the common symptoms of like a caffeine withdrawal. So it can help with that headache and it can help you feel more energized. It can help with lethargy, things like that. Yeah, I definitely need to drinking more water. So yeah, exactly right. So doing, 1 cup of coffee, do some water immediately after that and kind of do that routine. And then 9 times out of 10, once I see people do that, they're not even reaching for that third or fourth cup of coffee because they're so hydrated. They're not even thinking about it. So that could be, something to check into as well.
I would say too, Abby, like the timing of caffeine and like when you cut yourself off in the day,
Yes.
and looking at like how that, I mean, that definitely can affect your sleep. I mean, I have a rule for myself. I can't have caffeine past like lunchtime or I'll be up like all night. So I was like,
Yeah.
sometimes people forget like how long caffeine stays in your system too. So yeah.
Yep. Bingo. And then again, back to like the mental health, just reflecting, especially I feel like heading into Christmas and the New Year's is a big time for reflection for a lot of people. And so I like to encourage everyone, we're not going to reflect on the things, you know, that we maybe didn't get to or goals we didn't accomplish, but really look back on the year and see what you did accomplish. Even if everything didn't go your way and maybe it was a heavy year, I hope there were some positives, and it's important to, you know, reflect on those and see what you did well. And then after that, okay, what can I improve upon in the new year? What can I add, you know, to piggyback off of these things I'm already doing so well? And that helps kind of reframe it in our brain and not make it so all or nothing or that negative mindset heading into a new year. Okay, and that was my presentation. I also talked pretty quickly, but you guys had some wonderful questions. Are there any other questions that I didn't get to? Anything about nutrition in general? Doesn't have to be around the holidays. Fitness, anything like that? You guys did ask some really, really good questions.
Thanks, Dorothea. Appreciate the lovely comment in the chat. Excellent presentation.
Thank you.
Very helpful. Yeah, now's your time, y'all. This is your access to your dietitian. Samantha, great questions coming. What do you think can be good examples of quick workouts?
Yeah. So yeah, great question, Samantha. So if you are like working at the office all day, just if you can take, you know, a 5-minute walk or something like that, you know, a couple times a day, that adds up. If you're at home, my favorite thing to do if you want a quick workout is go on to YouTube and do 15-minute moderate workout without equipment. And usually there are thousands of videos on there that you can check out that you can do in the comfort of your own home. They won't need any equipment. 15 minutes, you do that 3 times a week, and that's wonderful. That's what I like to do a lot of the time too. If you have the ability to do this, I know walking pads are a big thing if you do work from home. I don't know what y'all's work situation is, but getting a walking pad and doing that while you're working from home is another good one. There's also good stretching videos on YouTube as well. But also we have to think too that stuff that we do around the house, it counts as exercise. So cleaning the house, raking the leaves, yard work, walking the dog, washing cars, you know, all of those things too count as exercise, or maybe even we're going to take the stairs at work instead of the elevator. Or we're going to park really far away at the back of the parking lot at the grocery store, and we're going to walk there, push the cart there and back. All of those are little things that we can do that make a big difference in the long run, adding up exercise wise. But thank you. Thanks, Samantha. You had some great questions.
Any last questions or comments for Abby?
And I can email this presentation to Brooke too if she wants to send this out. And we also have a handout too. If you guys want to share the handout with anyone that y'all have, that we would love that.
Yep, definitely. We can send out the resources. We're recording all of these, so we're hoping to like house all these on our website too for SEPHA. Again, you all please contact me if you need any more information about the nutrition section, about the association. If you have any interest in any upcoming speakers and topics, if you have any interest in our mentorship program, like please reach out. I'm happy to answer any questions that you have. We'd love to have you as involved. Save your date for Wednesday, January 15th. Dorothea Lewis is going to come in, give us a little health and wellness in the new year, getting us on the right path in case you get a little derailed in the holidays. I was like, it happens. I was like, Abby's giving you some great tips to try to stay on track. So but Dorothea will launch us in the new year on your health and wellness journey. So join us for that one. Any last questions or comments? Looks like lots of great feedback in the chat, Abby. I appreciate all the questions too.
Yes, thank you, everyone. This was fun. Oh, thank you, Diana.
Your fan club over here. We love you. Thanks so much, Abby. This was fantastic. I was like, I know even more people will get to enjoy it since it's recorded. So I was like, I know there'll be lots of views of this. So thanks so much, everybody. I appreciate everybody joining. And thanks for all your questions and participation.
Bye, y'all. Thank you.